Hi, I'm Dr. Lin. This is Stephanie, who grew on me all of a sudden. And there's a reason. She asked me about having high heel pain or wearing high heels, and she has pain in her hip and ankle and all that stuff that just isn't fun at all. So we're going to watch her walk before. I'm going to give her some tips and strategies, and those are the same ones that you guys can benefit from. So why don't we go ahead and just cut this and go towards watching you walk and pointing out the different things that we can help you with. So right here we have Stephanie walking her regular gait. And you can see if you just focus in on her left hip, there's a lot of sway over to that side. And as she's coming back towards us, you can see there's quite a bit of sway. Her right arm doesn't move, so her left leg has to move a lot more. And then it's just a lot of shearing that goes on in lower back. Some of you women that are going to have it. If we zoom down at the ankle, and you can see there's quite a bit of rotation or collapse at the ankle and foot joint. And so it's very unstable all the way up the chin. You can kind of see even all the way up to the neck, but not a lot of arm motion and just not very symmetrical if you're looking for symmetry. But boy, that left side really does collapse. And you know, I know just previously with Stephanie, there's some lower back concerns on her, and you can kind of see that in the way she presents her gait. And as she comes back towards us again, we're zooming in. And you can just see that collapse as the lateral ankle keeps collapsing down. We're going to cross her arms and go about 50% slower. And then, you know, some more. It's just a little bit more obvious now how much she used some of her left arm to keep her balance. Yeah. So as you watch the side view, you can see with her left ankle, it's a little harder to see, but she's not cresting over from her shin, from the back part of her shin to the front part. If you look at the right leg, she's actually doing a much better job, the more efficient gait. But this side's a better view. You can see that she's just not getting her shin to rock forward as every time she's about to push off. And that's a big problem for the hip. So how would you like to feel better walking in your heels?
Yeah, that's good.
All right, so yeah, let's kind of zoom in, and you're going to start focusing on her ankles. We kind of want to start there and get a better alignment. But every time you push off, Stephanie, I want you to think of your feet as a tripod. So your big toe, your little toe, middle of your heel. What we want, and the great thing about the foot and ankle is that we want those deep intrinsic muscles of the feet at the bottom of your feet to get strong. So what you want to do is you want to create a tenting. When the foot hits the ground in regular shoes, it splays and then you tense. So what we want to do is, here's a quick suggestion, is actually just to, every time you push off the ground, is to do this and create a tent through the middle of your foot, you know. And you can see, if you look at home on her uninjured side, that you can see that actually happens on her right side instead of the left. So let's go ahead and watch that again, and then I'll offer you another suggestion later about your standing posture. Okay, so go ahead and try that, and we'll watch you walk. So push off every time your foot is hitting the ground, and then it helps lead you over. Good. And you can kind of hear, at least what I can hear, is that the heels actually, they're not slamming on the ground quite as much. And if you look at the back of your ankle, hopefully there's a lot less wiggle in the shoe, and it looks a lot more controlled. And how does it feel to you? Yeah, so it feels a lot better for Stephanie, and you know, it saves her from a lot of injuries. So let's go ahead and zoom out here. And we're going to go back up to the top here. And so not just as a foot and ankle thing, but we want to get your postures, set yourself up for good alignment. So if I took you out to the side here, Stephanie, and we basically always talk over here, the anterior plumb line is your throat, your middle of your chest here, the xiphoid process, belly button, and your pubic bone. Those are the things that align. And if you can see on Stephanie, she's a little bit leaned back, and you know, that's how ladies, some ladies like to walk. But it's going to feel a little different here to align those 4 dots. And when you align those 4 dots here, you're going to go here, and it's going to be a little bit more forward than you feel. But she only moved basically an inch forward. But immediately when you do that in your heels, and answer this here, Stephanie, do you feel those foot muscles tighten up at the bottom of your feet? Because you're trying to grip the heels. So that's probably the best way to do it. You're already setting yourself up to do the foot tenting. So you want to try that at home and align these 4 dots, 1, 2, 3, 4. So we've added some corrections, and
Even though we didn't make any mechanical changes to her hip or pelvis, which needs some work mechanically and manual therapy, you can see that she's able to get a full length stride. She's able to crest over with her left shin, and it's a little bit more efficient.
And so you can give that a shot and let us know how it works. But yeah, this is a great way to help you walk in your high heels with less pain, if not take away all your pain. I'm Dr. Lin. This is Stephanie. Remember, we can and we will get better together.